Thank you, Commissioner. Thank you for being here. When we talked last time at your nomination, I asked you about our most vulnerable population, the 15,000 nursing home patients who lost their life. That doesn't include the assisted living individuals. And I asked you about the executive order that the governor gave out on the 25th of March. And you said you had not read it. And I think you mentioned you were not going to go back and unravel the impact on the loss of our most vulnerable population because of that requirement and mandate to put those with the contagion in the nursing home. Here's my question. This is a chameleon. It changes. It's a moving target. We know we have a virus now, which is even more contagious, but less of an impact, let's say, physically in terms of the loss of life, but more contagious. The governor at first, when he put this executive order out, actually said it was a matter of discrimination. People who are sick, people who have a virus, should be able to go get nursing home care if they need it. That was a mistake, I believe, because the discrimination was with those who were just compromised but didn't have the virus. My question to you, because he segued into the point where we're getting all our beds filled. We have nursing home patients who still test positive for the COVID, but they don't have symptoms. I have to keep them in nursing homes and put them in the nursing homes. Have you developed a different plan? Because even a fourth grader knows you shouldn't put people with this contagion into a place where people are compromised. Do you have a plan in place of what we would do with these patients who come from nursing homes, have to go to a hospital, recover, fight through it, but still have the contagion? Where would you put them if that happens? Because it is more than likely we're going to have a pandemic down the road and another virus, and it may be even worse than the last one.
Well, we have so many more tools now than we had a year ago.
What's the plan of where you would put these patients?
Can you? So we, as you know, we have now strict oversight of infection control. We have cohorting of patients as a means of ensuring that we reduce the risk of transmission within nursing homes. Earlier in the hearing, I was recounting that.
Put them back in the nursing homes?
I was recounting that we have been very successful during this Omicron surge.
Where to put them, but not in a nursing home? Are you saying you're going to put them back in the nursing home with a plan to separate them?
People in nursing homes have become infected with COVID-19. So we did have, during the first wave, there were up to 12,000 people who were infected with COVID-19 in nursing homes. During this wave, which saw levels of infection that we have never seen before in the general population.
Wouldn't it make more sense
so
to
we have
commercial companies and say, do you have a facility that we could utilize, beds that are ready, and all the needs that could take them into a separate place instead of putting them back with those who may be older, maybe
Jim, you've now used up your time and not allowed Dr. Bassett to answer the question. So you're going to have to take this offline. I'm sorry. Thank you. Back to the assembly.
Thank you very much. Appreciate the non-answer.